Today Africa Podcast is a podcast series where we interview African entrepreneurs and professionals and share the stories behind their businesses. In each interview, we ask how they got started, how they grew, and how they run their business today. The stories are inspiring and also provide specific advice and insight into starting a business. By sharing these stories, we want to help others get started.
Welcome to Today Africa, where we bring you inspiring conversation with Africans who are shaping the future of the continent. Today we'll be discussing about maternal and infant healthcare in Africa. Joining me today is the founder of VitalCare Connect, Kobusingye Mackline. She's an amazing woman who is improving maternal and infant healthcare in underserved communities in Uganda. Kobusingye, you are welcome.
Thank you for hosting me. I'm grateful to be here today to share my journey and my story, and I'm looking forward to learn from you guys, the audience, and as well as learning from me who's sharing.
All right. Could you please tell us about yourself and who is Kobusingye Mackline?
Yes, Kobusingye Mackline, that's my name, and I'm a Ugandan by birth and by nationality, and I'm a founder of VitalCare Connect, an initiative that brings maternal health care in rural and underserved communities in Uganda. And we do this by use of mobile clinics and reaching out to homes and communities. I'm also having a background of a life coach and a trainer at Social Innovation Academy. I've done this for 10 years now. And for 3 years, I've been in VitalCare Connect. So apart from that, I'm a bachelor holder of social sciences. So I'm a social worker. I have over the past 3 years, I have been an entrepreneur, and I've earned a recognition with the Survey Fellowship Prize 2023. I have been a Mandela Washington Fellow of 2024, and I have been a Young African Leader of 2023 East African. I've participated in the Stanbic Incubation Program for Women and Acumen Gender Equity and Acceleration 2023. So I'm a founder. Yeah, I have read a lot of books in entrepreneurship, but also I have trained over 5,000 plus youths under Social Innovation Academy and Jam International through life coaching and also being the trainer of coaches, certifying different coaches in the organization. And I'm bringing you some of expertise in dealing with youth and with women as well, coming from the rural communities impacting women and youth.
All right. You said something that really caught my attention, which is you have a bachelor in biology, social sciences, right?
Right.
Okay. I'm wondering what inspired you to start up a venture that is dealing with maternal and infant healthcare when we are not coming from health sciences. So, what really inspired you to start Vital Care Connect?
Good enough, I'm not far from where I started because I'm a social worker by profession. So I did not do the social work for the past 7 years back. I was just doing the empowerment of youth. And along 2019, the journey started for Vital Care, though it wasn't shaped that way. I had pregnancy and I'm a mother of two boys. So my second pregnancy was a little bit complicated at the end because this is the time of COVID-19. And this is the time when I had to lay off my work and get back to my home, which is Western Uganda, being taken care of my mother and my sister. I was heavy pregnant in 7 months. So this time I had stayed at least, I think, 8 to 9 plus years without staying in this community. I didn't know what really is happening. So this is the time I realized that accessing a healthy facility nearby, it takes 3 hours for anyone to reach by simple transportation of motorcycle. And also the road was bad to just ride easily. So the first time we attended antenatal, it wasn't easy for me. We just had to use a bicycle, and that was my brother taking me to the LC facility. But then the last time I was supposed to have my childbirth, it came unannounced, and I had to find ways. It was getting late in the evening at around 7 p.m. So we had to find ways to get to the healthy facility though. At that time, no car in Uganda, no motorcycle could move without a license or a permission because of the COVID transmission and all that. So that took us longer to figure out how to get to the healthy facility. But along the way, we managed to reach, and this time we had spent 3 hours figuring out how to get there, and more other 3 hours to reach at the healthy facility with a little transport of a motorcycle by my brother. Getting in there, it wasn't easy because I didn't find it was night shift, but then the professional medic wasn't there, who is the doctor, had attended another health facility. So we had to wait. But at the same time, my condition was escalating. This is the time I fainted and I became unconscious. So getting to be referred, it took us more other 3 hours to figuring out the ambulance to get there in another health facility, which is in Barara Health Referral. So I realized one thing after getting out of the unconscious, I was on oxygen with my baby. And this is after I was saved by a professional doctor and a cesarean. And to me, this was a catching eye, getting out and finding my mother and my sister very excited over the situation. But then getting home, it took us longer to heal, but also physical and emotionally had to keep thinking about the whole scenarios. So getting back to work, where I was empowering youth, I had to keep thinking bigger on what is actually currently happening in the community that I had stayed longer without visiting. So that is the time I met a midwife whom I was working with, but I realized she has also abandoned that midwifery because of the situation she didn't like to share most of the time that happens in the healthy facilities. So we had a conversation and we agreed that surely we can do something. So me and my husband and uh, nurse Barbara. So we had to figure out the concept on getting to the healthy facilities, talking to what is happening at the healthy facilities with health workers, and find out why don't they at least use a different model for women to be able to understand the situation they are in, because we do not know where to start. But that was also the right time that we happened to meet 30 women in the village, and they shared their experience. Most of them were frustrated with the long distances to the health facilities, less resources after getting there, but also long queues waiting to get the services. And most they are also frustrated with how they are responded to in terms of the attention. So that lacked a little bit of connection from by the health workers to the women, but also a little bit of women being poor, not to afford to public health facilities where they can be easily attended to. But of course, it comes with a cost. So those conversations opened our eyes, and we're like, okay, what could we do? So the easiest thing that we could do, that was 2022, is to start bringing out information, maternal health information. So during the maternal health information, we realized that surely women need more than just healthy services. They need to connect to the person who is attending to them. They need to share more than what they are sharing in terms of how their home is set up, how they are supported at home, and how can they get the services. That's how we organized a model which is a mobile clinic. Mobile clinic is a moving clinic that attends women wherever they are in the different places, finding them in their communities and provide services they would get if they get to the health facilities, but also getting in involve people who are next to women, for example, their husbands and the families, as well as the community health workers who are always around them and sharing with them. So that's where we started working with most of the community health workers who mobilize women. As for us, we bring in our mobile nurses, getting in the community with pregnancy checks, medication, referrals, deliveries. And then along the way, we realized that only that is not enough when women come with no resources at the time of childbirth. So we added there the birth kits. So birth kits are these essentials that are needed by midwife to conduct childbirth, including sterilized gloves, cotton, coat tie, all those essentials. They could hinder women to get to healthy facilities because they could get embarrassed whenever they don't have or even they have to wait. So we added that package that we provide to women as well. So more so along the 2024, we just realized most of the babies are born while less weight because of the poor feeding of mamas. And also the babies after 6 months, they are not fed well because of lack of knowledge and resources as well. So we added nutritional storage. So that's how we have three combination of things: the antenatals, then the birth kits, and then the nutritious porridge to be able to eliminate maternal health in Uganda. And what I forgot a little is that by the time we had to do this, Uganda was standing at a way in a way that we could lose 6 women daily in the maternal health in 2023 and 84 infants before the 24 hours of childbirth. And this was really alarming than any other cause of diseases. So it wasn't only me, it was all majority of the women, especially in rural settings. 70% of the women couldn't access maternal health services. So it came at the right time where we needed to save lives, where I needed to do more than expected. Yeah, that's how VitalCare started at that time. But when it was a community health, a community, a CBO, a community-based organization, it was in the names of Mother Support Foundation. Then in 2023, we just realized that we need to scale out from Uganda district since we have the birth kits project that need to be produced in the area where we don't have resources. So we started a birth kit project in Impigi district, central Uganda, and we needed to expand. So we changed Mother Support Foundation to VitalCare Connect due to legal registration of names and requisition. So this was the reason why we have VitalCare Connect, not Mother Support Foundation, but still doing the same vision and the same mission.
You turned the problem or the situation that you face into a solution for other women not to go through or encounter such. And then you are providing care services, giving them information, providing bed and kits. So are there other services that you people are provided outside the three that you mentioned?
Everything that we bring out is for maternal health. So when we talk about the antenatal and postnatal, here we have different packages. So we have the pregnancy checks, we have the deliveries, we give the referrals in case somebody needs a referral and we cannot handle the situation. So we have the immunization for babies and the information on family planning methods. And then for birth kits project, we have information about the hygiene and clean, safe birthing situation for women, accompanied with the hygienic and clean birthing items, which are the birth kits, with all the essential items. And then we have added the nutritious porridge to cater for nutritional challenge to solve nutritional challenges faced by pregnant women and mothers. So those are the services we are offering. And along the way, we have the mobile reminders for women that we send to allow them to be able to attend the services they get. So we do this with follow-ups and home visits, as well as holding outreaches in the name of mobile clinics, getting to community after community and after community, giving these services. So we are not located one place. We are in different places giving these services, but most importantly, we are in two districts. So we have Ibanda district and in PG, and then extend our 40% of our profit in refugee communities because they cannot really afford completely the refugee women, especially the single mothers and the teen pregnant girls.
Let's talk about the challenges that you faced in the beginning. Because every venture had its own challenges. So, what were the challenges that you faced, and how did you overcome them?
It's figuring out a vision is easy, but implementing what you say you do is really always a challenge. So at first that was really hitting was how to explore the hard, how can I say, how to get to start and whom to reach to start. So first of all, me, as I say, I wasn't a medical professional. I needed some people who have medical information with them. So I had to tell my story to different people to get accepted on who is to be on board. And it wasn't about also accepting, it was about how do they understand and align with what I say, and how does it resonate with what they are heading to do. So that was really a tough time. I think I remember having conversations with almost my friends, and I couldn't get none of them that was interested. I was like, oh, maybe something I want to do isn't the right thing. So next is that people I started with were three. After starting real work on ground, when even I had a nurse in the team, she was the person to get out fast. It's real, it's realistic. So she got out fast. How? Um, Something came up, and I think she had personal things to pursue, and she laid it out. I'm like, how are you going? Yet we are just started and we are supposed to get into the community. And she's like, no, I just realized I have to go on for school. So I couldn't do anything. So I let her go. And I started afresh for finding who is to fit. First of all, in Uganda, you cannot do anything when you're not legally registered, when you're not consenting with the legals. And there are needed licenses and all legals that are needed. So I couldn't do those things. I need people who have academic background on health, and we'll be able to do that. So I have to move and find someone who resonates. So that was really a challenge of the team. Secondly, after getting the people, now it was how do we start? We just had to face the hard reality. We have to spend on things that we do not think of. I had not joined any entrepreneurship program to schedule and plan and strategize on what is to spend on and what is not. So every day we could wake up, we realize, yes, we need to go to the community, but we need fuel. So we need to go to the community, but we need to spend on this thing. And then one more frustrating was when we realized the problem is too much than what we can afford. And what women say have trust in us are not getting what we are giving. So they are not satisfied with what we are giving at the moment, because the first thing we're just giving information and telling them, and they were like, okay, we have had these things. Many people have told us. But then can I find way how to get a solution on what you say? How can I do it practically? So We needed resources and finances, which was not there. So how could we now get out of that? We started looking for different opportunities, talking to different people on how to get resources on board. Then we reduced on the number of how we are moving very fast from a village to village. So we had to first capitalize on one village. At least, like, okay, we can first capitalize on one village. On few individuals, we started with 30 women. We couldn't add any other women in the first year of 2022. We stayed with 30 women throughout because we needed to at least confirm what we are giving, have conversation with these women and find out how change is it doing to them and how different can we become from other parties in the prayer on the same industry. So those were some of the challenges. And what wasn't after starting looking for resources is that after applying for different kind of proposals and all that were not accepted, and we are told by different mentors and different business coaches it is better to build a network. It is better to build a big network for yourself so that at least when people have known you, they will not invest in what you do, they will invest in you. So it was really a hard challenge because exposure in entrepreneurship wasn't there. So that's when I and my team, we got out of shells and started getting into the incubation program of entrepreneurships and getting to learn with the intention at least to make network, not to get money, because the first was money. But this time we're like, okay, we just need to go and get to be known, to do something, and we get people who are connecting with us. And yeah, with time it is becoming somehow easy, but it was not easy because 2022 itself was almost a change of models, change of people, change on clients, on focuses and everything. 2023 was more of learning, interventional programs, getting into this from this to this, from this to this, until when we were able to shape our model. And then we could also win some prizes along the way, and this supported us slowly by slowly.
You talked about finance being one of the problems that you faced in the beginning. Based on the services that you are providing a lot of services, not just services, you are actually giving out products like the health kits, for instance. So how are you raising capital or money to sustain these services and products that you are giving out?
So at first, we wanted to give these services to people who cannot afford, completely who cannot afford. And then we realized that in order to do that, we need to have enough resources, at least $51 per woman, to be able to have their antenatal and postnatals, at least for 1 year. And then we realized few individuals and few donations can do that to us. So what we did is to extend our services to those women who earn but are also not able to have this access to our services. So we started charging some of our services. And along the way, we realized this is not going to be enough. We have also seen there is money left on the table in the birth kit projects. Many people who are doing these businesses are in towns, are in urban places, and they are not reaching the community. Yes, community people are accessing them at a very big pricing. So we started doing it by ourselves because it could help us. Every woman who could meet could buy this package outside the services they get. So also organizations, companies, and healthy facilities could buy. So we made sure that at least each 40% of what we get is extended to those who can't afford in terms of our services. So if, for example, for a basket, if we sell, we have two packages. We have the small package, and then we have the labor suit package. So if three labor suit package are sold, then one woman who can't afford would get one small package of $6 if we sell the other one at $9. And then we also did the same with the antenatals. So if we get a woman who buys the antenatal, three of them are able to pay for a one woman for a half of their antenatals. So this was something that we needed badly. So that's how we started doing it. That's how we started doing it in the time when we did not have enough of resources.
Take you back a bit, about the both antenatal and post-antenatal service people are offering. You talked about is giving out information to the women. And this information, is it one-on-one whereby you will go to the community, speak with these women, or is it that this information are being accessed like through the internet, whereby they just access it online?
So, in our way of working with local communities, so we have two models. One, we have the physical, where we meet women, gather in the gathering, or on one-on-one during the follow-up sessions and home visits. So this is where the women can get the information. Secondly, women always get our information through the media channels. So this is the local radios and TV, television. So hosting a television show and a community radio information would also support women to get the information. Then thirdly is the information that we forward, which is customized on to a mother, depending on the level they are at, via their small phone, using an app where we send that information depending on what kind of a situation a woman is at. And this is only done on a customized way. So information is very essential for us because it is one way of the hindrance to the challenges that women face because of beliefs and customs and myths that they have around maternal. This hinders a lot of progress if it is not tackled from. So that's how we get our women get information.
That we are working with people, both people that are coming from the health with health background and people with non health background. So how are you able to build a culture that helps a smooth running of your business?
I would go back to my personal story. People connect with people on a personal level. So the first thing that really supported me is to be authentic and tell a story about who I am and what I'm able to do and what I'm not to do. So I realized that losing people is not bad so long as someone understands where you're going and they don't connect. And then getting to get somebody to join you for 3 years, the people we have been having are really those who have connected deeply. Secondly, most of the times we have two people, for example, could be two people. How to expand depends on how we are bringing other people around us into what we are doing and how they feel comfortable. So environment and culture is important. Information sharing is another thing that is important. But most importantly is telling the vision. Where are you going? Why are you into this? Those two things. Where are you going and why are you into this? So this brings more people than what you're able to give them. So along the way, we have had people who have been with us for volunteership, and we have had women who have come for commission based. Probably they are selling, they are distributing birth kits, and they are only getting a little commission. But apart from that, they do more than what they are supposed to do. They give information on birth kits, they educate women, and they are able to join us. So working with community health workers who are already on ground was like an open door for us. And how do we get them? When you get one healthy worker or community health worker, that one brings another friend. and another friend brings another friend. So it is on a referral and recommendation basis than just putting an announcement, we want so and so. So for the beginning, when we were 3 people, and then for the first year we are 6 people, and currently we have a variety of working with 52 people. What do I mean is that 52 people are all inside the maternal health, have been participating in health programs, but haven't found how to connect, coordinate with each other. So what we give is a community engagement and involvement on how everyone could bring themselves to make a purpose on something and contribute an impact. I think for me, the biggest takeaway is people always want to get into something they feel connected and contributing. And if they're able to get that space where they feel contributing, and what they get is not the matter, because they always feel they are contributing to something bigger. So that's how we've been able to reach out to different individuals, health wise, and those who are outside the healthy industry.
How is VitalCare Connect doing today, and what does the future holds or look like?
Currently, VitalCare Connect is able to hold 10 mobile clinics per month. And in the 10 mobile clinics, we are able to meet 3,000 different women in different communities with our products and services. We are also working with 21 men and 30, 21 men and 31 women inside, so that at least where we need a man's voice, it is reached, and where we need a woman's voice, it is reached. Because we realize that majority of the people who pay for either product, they are men. Women are the one who use. Men are the one who pay. So we need to have them engaged. So this has really been a great shift for us. And currently, we have, for the 3 years we have worked together with women and men, this shifted us to reach to 80,000 plus individuals with our services. 7,000 have received our antenatal services, and 80,000 plus have received our nutritious porridge and birth kits. We cannot do this alone. We have been working together with private and organizations that work together with women and health in health and outside health. You wonder that there are companies and organizations who are working outside health, but they want to do something in the health sector. So they would work with us and trust us because we are already inside, and it makes sense to collaborate and make partnerships. And above all, I think what has made us move faster is every time we are in the network, as I told you, any network we have has brought a different network for us. So we find ourselves getting a network that brings more other networks, and that's how we happen to get our collaborators and our partners on board. In the future, we are looking forward to extend out much of our services in refugee communities. Why refugee communities is because, however, we are getting more into getting and to make money. We also realize that there are those people who never have chance to make their own money and sustain themselves, and those are people who are war-torn and who have got out of their communities because of the challenges. So Uganda currently is hosting approximately of 1.8 million who are refugees from Sudan, Congo, and Burundi, and all other countries. So 84% are the women and children who really need a lot of support and cannot afford. So it is much for us to think on how can we contribute to them. Only if we are able to scale up our 40% of our profit that we offer to refugee communities, we'll be able to serve these communities with our services, especially if we can start with a fewer. that we can have. For example, in Western Uganda, we have Nakivale refugee community, we have Chaka 1 and Chaka 2, we have Changwari refugee community, we have approximately 4 refugee communities. And these are hosting people from different countries, speaking different languages, needing these services. Yes, being supported. We also know that in Uganda currently and in Africa, we are affected by the US funds. But beyond that, we must continue moving and supporting each other. So the best way to do is to do a business that can contribute a social impact.
What are the key lessons that you have learned in your journey as an entrepreneur?
What I've learned is that it's never hard and it's never easy. So what do I mean that it's never hard? It's never hard if you start immediately. You will always share and get support from the people around you. People hearing you talk about what you want in life and how you want to get there, what you want and where and what you want to get. They will figure out how to get there. How to get there is always figured out along the way. Then, secondly, my learning is that entrepreneurship is a lonely journey if it doesn't involve personal awareness and personal growth. I think I have got involved in different platforms like Young African Leaders Program, just talking about leadership and how to get yourself as a leader before you lead others, how to lead yourself. It can be so much overwhelming. So it is a combination of getting involved in different programs that uplifts us individuals before we think about uplifting other people, and know how to work on ourselves and deal with whatever is running inside us so that we can offer the best out of us. And it's not going to be hit in the first years. Maybe one day I can wake up. I've been waking up while feeling so down, not to even think about to do something in maternal health. I'm just thinking about, okay, so this challenge is available, but there are people who are doing well without figuring out why they need to meet other people's need. They just get out and get employed, and you just work for money and you get what you want. But then it is important to align yourself with what makes you happy. Some people like us, once you already have a struggle that needs to meet someone's need or some people's need, every time you work for money, you get empty. You get it, and then you feel like, okay, I think this is not all. Maybe I needed to have some impact somewhere. So it is important to always listen to self and go on. Today I'm meeting you and we're having this conversation. I don't know how you got me. I think we got on LinkedIn. So this is the reason why you just need to start moving. People will meet us along the way, and people with the best for us will always meet us, and we'll always have to connect anyway. So never fail to start. Just start.
What advice would you give to women who wants to start their business or who are just starting their business?
I would actually say that when you're a mother and a woman, you can be a woman without being a mother, but you're a mother and a woman at the same time. You have got to think bigger every day, because there is how you can forego and sacrifice your own dreams to the children and to the family and forget your existence in life. So as a woman, today I celebrate Women's Month because I remember that as a woman, there are many hindrances that gets us to lose our focus and our purpose in life. And we think that probably we're doing the right until when we end up getting out and we feel empty and lonely because we gave all to the family and we didn't think about the purpose. But also as a mother, family matters, because a family is the source of energy. that we wake up with every day to get to work. So today I'm here talking to you, and my son is on my side and is asking me, Mommy, can I get something from you? I would have to balance this life. So I have to balance on how to take care of myself, take care of the third party, which is my family, and also do the business as well.
Today Africa Podcast is a podcast series where we interview African entrepreneurs and professionals and share the stories behind their businesses. In each interview, we ask how they got started, how they grew, and how they run their business today. The stories are inspiring and also provide specific advice and insight into starting a business. By sharing these stories, we want to help others get started.